Mm-hmm. Mm-hmm. Yeah, so I've already reached to the subcostal margin and there's nothing palpable. That's totally normal. That's totally normal. Alright, now here you can go and find out the span of the liver, but you can go ahead and do the splenic examination. So for a splenic examination, what were you going to start with?
The right iliac.
Right iliac.
Exactly. You're going to start again from right iliac region and take your way all the way to the left hypochondria. So if up to here you don't feel anything, then you can ask the patient just roll a little bit to my side. Okay, that's fine. Just that much. Okay, and then I'm going to feel with both hands, right? I'm going to press with my left hand at the back of the patient, and then I'm going to feel with my right hand here. Okay, so if it is slightly enlarged, with this maneuver, it's going to show up. Right, it's going to show up. That's perfect. Now, suppose in your palpation you feel that the abdomen is rigid. What are you going to do? If you feel that there's a rigid abdomen, the abdominal muscles are contracting.
Yes.
What would you do?
Yes, him to flex his knees.
Bends his knee. Yes. So can you bend your knee? Okay, great. So even at this position, the muscles are contracting. What's the next maneuver would you like to do? All right. You can just ask the patient to just lift up a little bit of their back. You know, if they lift it up, it'll become a little bit more relaxed. Or you can press a little bit over here. Anyhow, if all that is didn't relax the abdominal muscles, it means that there's a rigidity. There's actual rigidity, and sometimes it is even wart-like rigidity. All right, great. So now we'll move and do the percussion. So for the percussion, to determine the span of the liver, how would you determine the span of the liver? Yes. Yes. Initially, starting from the jugular knot, going all the way to the angular oblique. Yes. It's the second rib, right? So below that, you've got the second interspace. You've got the second interspace. At the mid-clavicular line, you're going to percuss. How are you going to percuss?
Using your right middle finger.
Middle onto middle.
Okay, great. Yes, with the exactly with the other hand, you're going to tap with the movement of the wrist. Yes, of the wrist. So with the middle finger, you're going to percuss over the middle phalanx of the middle finger. The middle phalanx of the middle finger. Everything middle. Okay, so here it turned to dull, right? You got it? Yeah, so it is dull. So this is the upper limit of the liver. This is the upper limit of the liver. Now you come back and start from here. So you know the upper limit, that's the extent. You start from here now. It's dull, right? Yeah. So this is the span of the liver of this patient. You can actually take a measure and actually measure this distance. Okay, and that will be the span of the liver in this patient. All right. The next thing is what you go ahead and percuss again. You know, you can percuss also for the liver, but then I heard that you haven't been taught about that. So we'll just go ahead. The spleen also you can actually percuss, but then as part of this, you don't need actually to mention about that. You can actually percuss for the liver and look for the spleen also. You look for it. Look for the ascites, exactly. So how do you look for the ascites? We said that initially, if there is any flank fullness and things like that, if there is distension, yeah, the umbilicus will be everted. So you try to find out the maximal area of resonance. So here, and then you move your hands like this. Okay, you're going to move in that way, both directions, right? So it's already turned dull. Yeah, so it means that it's already in the flank region, and it's totally normal. That's totally normal because in this area normally you will get the lumbar muscles, and it will definitely turn dull. But if suppose in this region you've got the dullness, then what does it indicate?
Ascites.
There is an ascites. So the fluid is actually accumulating in this region. So here, suppose it was the resonant here, and then here it turned dull. It means that. Then you ask the patient to turn around. Yes. What we call this? Shifting dullness. Yes. So we'll just allow for the fluid to gravitate, and then start again percussing over the same region, right? And then go back, and now you will feel again an area of dullness. You ask the patient to roll back again. Yeah, and then this region, if you percuss again, it will turn again resonant. It will turn again resonant. Do you know the concept behind it?
Yeah.
Yeah? Do you know the concept? You see, like, this is supposed to be the abdomen, right? This is the abdomen. And that's the fluid that is gravitating, right? So you're starting from the umbilicus here. You percuss all the way, you know, it is resonant, 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 all the way till here. Then it becomes dull, right? It turns dull in here. Then you ask the patient to turn. So that's your level of umbilicus, right? You ask the patient to move, right? What happened? Here turn resonant again. You go all the way, and now your dullness is here, around the umbilicus. You ask the patient to go back again. Here again turns resonant. You do it on the opposite side as well. Do it on the opposite side. Right. Now, suppose if there is a massive ascites, what would you do?
Transmitted thrill.
Good, good. You look for the thrill. And how would you look for the thrill?
You ask the patient to hold their hand.
Yes, or an assistant to just, yes, put the hand over here. Can anyone show it? Can anyone put your hand in here? Yes, thank you. And then you're going to feel with one hand, you're going to tap with the other. So I'm not feeling anything, right? So it means that there's no ascites. If there's a massive ascites, then you won't feel the thrill is getting transmitted all the way till here. If you've got very minimal amount of fluid, very good, yeah. You can ask him to basically like get into a knee heel position, like this. You know, anyhow, and then you percuss, try to percuss over the umbilical region. Okay. That's an old method actually, and then no worries, it's taught in the books anymore. And you don't really need to know about it. If you mention it, it's good. Other than that, you don't really need to perform it. What's the last thing? What's the last thing we talked about? We talked about the inspection. We talked about palpation, percussion, and the last thing is auscultation. What do you want to look for your auscultation?
I'm not sure.
So what are the things that you will auscultate for?
Bruy?
Well, you can auscultate for bruit, yes, but vowel sounds is another thing, yes. So initially you'll have to go with the vowel sound, and then you can actually listen to the renal bruit as well. Okay, so for the vowel sounds, where is the position of the step? Where has to be the position of the step?
Around the umbilicus?
Okay. Well, you can actually hear it in all the areas, but what is the most prominent area that you look that we're going to look for? What is the area that you will hear it the best? No. Well, actually, yeah, exactly. So yeah, when the small intestine and a large intestine are going to meet, and what's that point? Yes, ileocecal junction. Ileocecal junction. You're going to look for in the ileocecal. And where's the ileocecal junction? Is it on the left?
No,
Right.
Okay, on the right. Yes. Okay. So where in the right? It's yes, right in the left. Also, particularly it is in the McBurney's point. You know where the McBurney's point?
We haven't done the digestive system.
Yeah. Oh, okay, yeah. So anyhow, like in this area, as far as you put your stethoscope in this area, you are in the safe side.
Okay.
Okay. And for how long did auscultate?
I think we did.
The auscultation is not there?
We haven't done auscultation on
okay.
the abdomen.
Yeah. For how long?
Per minute?
No. Because ideally, it should be lasting about 10 to 15 seconds. Every 10 to 15 seconds, you're going to hear one vowel sounds, right? But if you say that there is no vowel sounds, how long should you wait?
30 seconds.
30 seconds?
No.
30 seconds.
No?
Minute.
1 hour? Yeah? Well, you got to wait for 2 minutes. At least 2 minutes you got to stay until you say that the vowel sounds are absent. Yeah, that's great. There are many other maneuvers actually in the abdominal, but as far as like the general thing, you know how to do inspection, palpation, percussion, and auscultation. That's perfectly normal. There are many other things like succussion splashes and how to differentiate the pulsation here. Is it an aneurysmal dilatation or is it mass above it? Those things like you'll get to know like later on as you proceed to the gastrointestinal systems. We'll talk about those things, right? Are there any questions and things like that? Yeah.
Dr. Abe told us that at the end you say I'd complete my examination by doing
good.
vital
Yes.
signs and
Yes. Well, in the cardiovascular system, definitely you've got to mention all those things.
Okay.
I want to do like weight measurement, the height measurement. I want to do urine tests also. But with regard to the abdominal examination, you always say that for this patient, like suppose we haven't done any inguinal region examination, right?
Okay.
Inguinal region examination, lymph node examination, inguinal region, and one thing always you have to mention at the end.
Thank the patient.
Thank the
No,
patient.
no, before, no, as part of the abdominal examination, as part of the, you would like to do a rectal examination also. That's also always part of the abdominal examination, PR examination, rectal examination, digital rectal examination. Yeah,
That's part of the gastric.
that's always part of the abdominal.
As a nurse.
examination.
As a nurse.
Yeah, exactly. You can look for a prostate.
But when we walk in, for example, just to the ASPI station now, because it's coming up,
Yeah.
do you start out saying that you would do vital signs and general appearance, or you just go straight to abdominal examination?
Well, if we tell you to do an abdominal examination, we don't expect you to mention all
Okay,
those.
so just introduce yourself.